Guam's early battles with COVID-19 were strong and forced cases down. Unfortunately, new cases surged in August and we could not bring it down to previous levels, only to see an even higher wave surge from there. As a result, we have seen COVID hospitalizations rise in similar fashion. This is a big problem, especially on Guam.
In any hospital, the capacity to treat patients is based on the number of beds available and the professional healthcare staff available to treat these patients safely. Many of these beds are already occupied by the typical non-COVID patients, such as accident victims, stroke patients, and so forth.
But when healthier people get COVID and go around spreading it, they wind up infecting vulnerable people, sometimes directly, and sometimes by infecting someone else who then infects a vulnerable person, like some of our manamku. COVID can infect you fast and make many sick fast, which ultimately fills up hospital beds fast. Like most of the world, on Guam, the young, especially those in their 20s and 30s, make up majority of the COVID cases, but it's primarily our elders that are dying prematurely from it. Overall, those younger than 60 years old make up 88% of cases. Yet it is those over 60 years old that make up 62% of the deaths related to COVID. If you died in your 60s, that's about 2 decades short of the average life expectancy.
So as our hospital census rises, the crisis only worsens. Some with severe cases of COVID can't get care or suffer delays. And some who could be saved die. Plus, some with other medical issues have same challenges, and some of them die too.
So what exactly is happening on Guam most recently? We can look at Guam's admitted COVID patients, the non-COVID adult patients, and the combined census numbers of both groups. Typical capacity on Guam for adult patients is about 150 beds between GMH and GRMC. When the total census goes above this, it becomes increasingly difficult to provide the safest and most effective inpatient care, thus creating a surge crisis. Many on Guam are fighting for their lives, while our hospitals are resorting to extraordinary measures. Surge conditions equals potential for avoidable deaths. 95% of all the COVID-related deaths on Guam have occurred during the current waves. We are seeing record deaths in 2020, with September being the deadliest month. The official count from October is on track to surpass September. Even the non-COVID deaths have been above the average recorded over the past 5 years. To stop the spread now requires stronger efforts beyond what we've already done. Many in Guam have done a commendable job protecting themselves, their families, friends, and even strangers. But there are still some that don't, either because of COVID fatigue or momentary lapses in keeping their guard up. Then there are some who outright defy recommendations from the medical community. Our hospital surges may be made of only the severe cases, but it was generated mostly by people who didn't feel sick. That means the people who can do the most to avoid unnecessary deaths is the community on Guam. That means you. That means all of us. This war with COVID is not ending anytime soon, but when we all do our part, look what happens to our hospitals. We flattened the curve. Remember that phrase? It really can save lives.
Inafa Maulik literally means to make good, but really it's about restoring harmony to our community. Right now, there's no more meaningful way to do so than to respect and protect each other. You have the individual power to help us. You are the key. Can we count on you?